Legionnaires' disease. Legionnaires' disease is a severe form of pneumonia, a lung infection. It's caused by Legionella bacteria. These bacteria thrive in warm water environments. The disease isn't contagious. You can't catch it from another person. Instead, it spreads through inhaling mist or vapor contaminated with the bacteria. Recent outbreaks. In Sydney, Australia, in 2025, 12 confirmed cases and 1 death have been reported among individuals between March 13th and April 5th. Legionella bacteria were detected in a cooling tower in Sydney CBD, which has since been decontaminated. Over 165 cooling towers have been inspected and tested. In Melbourne, Australia in 2024, an outbreak resulted in 109 cases and 2 deaths, linked to a contaminated cooling tower in Laverton North. The tower was promptly disinfected, and the outbreak has been declared over. In United States Grand Rapids, Minnesota in 2023 and 2024, 34 cases and 2 deaths were associated with the municipal water system. A chlorine disinfection system was installed, and no new cases have been reported since June 2024. In Albany, New York, between August to September 2024, 20 cases and 4 deaths occurred in an assisted living facility. Investigations are ongoing to determine the source. In Lincoln, New Hampshire, between June to July 2024, 5 cases were linked to a community outbreak, with investigations pointing to a cooling tower as the potential source. In Europe and Lombardy, Italy, between April to July 2024, 53 cases and 4 deaths were reported, suspected to be due to deficiencies in building water systems. In Rzeszów, Poland, between August to September 2023, a significant outbreak resulted in 166 cases and 23 deaths. The source is believed to be contaminated water systems, with investigations ongoing. In London, UK, between July to September 2024, 30 confirmed cases and 2 deaths were reported, linked to a community outbreak. In Foshan, China, during November 2024, 9 cases were linked to tour groups, with investigations focusing on potential exposure sources. In Hong Kong, in October 2024, 2 community-acquired cases were confirmed, bringing the total number of cases to 89. Investigations into the outbreak sources are ongoing. In New Zealand, up to September 27, 2024, a total of 108 cases were documented, with health authorities investigating potential sources and implementing control measures. Risk factors. Number 1, individual-level risk factors. Age 50 years. Older adults have a higher susceptibility to infection. Smoking. Current or former smokers are at increased risk due to compromised lung function. Chronic lung diseases. Conditions like chronic obstructive pulmonary disease, COPD, elevate the risk. Weakened immune system. Individuals with immune suppression from diseases, for example, cancer, HIV, or medications, for example, chemotherapy, corticosteroids, are more vulnerable. Underlying illnesses. Diseases such as diabetes, renal failure, or hepatic failure contribute to increased risk. Number 2, environmental and occupational risk factors. Exposure to contaminated water systems. Inhalation of aerosolized water from sources like cooling towers, hot tubs, decorative fountains, and large plumbing systems can lead to infection. Healthcare settings. Hospitals and long-term care facilities with complex water systems may harbor Legionella, posing risks to patients and staff. Travel and accommodation. Staying in hotels or cruise ships with inadequately maintained water systems can increase exposure. Occupational exposure. Workers involved in maintenance of water systems, gardening, or landscaping may be at higher risk. Symptoms of Legionnaire's disease are similar to other types of pneumonia. They include cough, shortness of breath, fever, and muscle aches. Headaches and gastrointestinal issues can also occur. Diagnosis requires a lab test. Doctors typically test urine or sputum samples. Early diagnosis and treatment are crucial for recovery. Prevention strategies. Number 1, water system maintenance. Implement routine checks of water systems for temperature control and disinfectant levels to inhibit bacterial growth. Develop and adhere to comprehensive plans that include risk assessment, control measures, and documentation to manage Legionella risks effectively. Ensure water systems are designed to minimize stagnation and biofilm formation, which can harbor bacteria. Number 2. Public health measures. Mandatory reporting of Legionnaire's disease cases aids in outbreak detection and response. Inform building managers, healthcare providers, and the public about risks and prevention methods. Adhere to local and national guidelines for water system maintenance and Legionella control. Number 3. Personal protective measures. Use appropriate personal protective equipment when working with potential sources of Legionella. Wear masks and gloves when handling soil or compost, especially in regions where Legionella longbeachii is prevalent. Wash hands thoroughly after exposure to potential sources and before eating or drinking. Treatment. Legionnaire's disease is treated with antibiotics. Most people require hospitalization. With prompt treatment, many patients recover fully. However, complications can occur. These include respiratory failure, kidney failure, and septic shock. The severity of the illness depends on the individual's health and the timeliness of treatment. Legionnaire's disease is a public health concern. Outbreaks can occur, affecting many people at once. Public health agencies investigate outbreaks to identify the source and prevent further spread. Staying informed and taking preventive measures is vital. Understanding the risks and how to minimize them protects our communities. Together, we can reduce the impact of Legionnaire's disease.